Hello, today's case study that will be discussed includes a 70-year-old Asian male named Raymond who lost his wife 6 months ago, who is self-isolating, has an increased use of ETOH at night, and also some concerns medically and some fears with future living situations. Okay, we'd like to start. Hello, Raymond. Last session, we discussed some of the struggles you've been experiencing from the recent loss of your wife and how your life has changed since her passing. Can we talk a little bit about how you're doing and what's been going on?
Yes. So my wife died 6 months ago, and since that happened, I am on my own, and I pretty much do nothing other than wake up, maybe make some food, but mostly I just want to drink so I can fall asleep again.
Okay, so I'm hearing that you're having some difficulty sleeping. What significant changes do you think you've been experiencing since our last session when we met?
I would like to do something because I don't want to die, but also, why do you want to stay alive when I don't have nobody to talk to? And I'm lonely. I'm lonely and I don't see nobody. All the days are there on my own.
Okay, so what I'm hearing is some of these significant changes may be, and have you been feeling an increase in depression or depressed thoughts?
I don't want to die, but I don't see any point on staying alive either. I would like to find something that wants me to want to live again.
Okay, I can understand that having some companionship and the relationship with your wife for so many years, your roles have significantly changed from sharing your life and responsibilities with someone to now doing things on your own. Can you tell me about some of the things you loved about your life and things you did with your wife and being a husband?
I used to do everything with my wife. When we met, we had nothing, and we worked hard, very hard. She was a very good companion, very hard working woman. And everything seemed to be better when she was alive. We used to enjoy the same food. We used to watch the same shows, and we would go together for walks. And sometimes she would even come with me to the gym to swim in the pool. And she was entertaining. She would make me laugh. She was everything to me. When she was around, I didn't need nobody else around. It was just her and me. And now that she's not here, it seems like I don't have a life anymore because all my life was around her.
It sounds like you are a devoted husband and really enjoyed being a husband and providing, for your family, and really enjoyed your relationship with your wife. Can you tell me things about your life that maybe you wanted to change, or that ever a time you felt unhappy for any reason?
I normally don't like other people because I feel the other people are not interested in the same things I am. when I am around them, I don't know what to talk about. They don't like the same food, and they worry about other things. But I feel lonely, and I don't want to be alone for the rest of my life. I might be living maybe 10 or 20 more years. We don't know that. And what am I supposed to do? I don't see my children, and I don't want to bother them. They have their own life, and I want to be able to take care of myself. But I see other people that are all like me, and they are lonely. Nobody takes care of them. They get depressed, and then they fall and break their hips like my neighbor, and then they go and have to stay in a nursing home. Nobody cares about them. I don't want to end up like them.
It sounds like your role as a husband, a provider to your family was successful and brought you a lot of happiness. But in a lot of ways, I'm hearing that your life has changed, and maybe this could be a time that life is presenting you opportunities maybe to interact with more adults. What are your thoughts on that?
I think that that's what I should do. But I don't know if I can talk to any other people. I wouldn't know what to say.
Okay, well, why don't we do this? Why don't we talk about your day-to-day activities before your wife passed, and then what your day-to-day activities look like now, and maybe we can go from there.
Mhm. So when my wife was alive, I would get up at 6 in the morning because I wanted to have the breakfast ready for her when she will get up. So I will go and buy the groceries, and I will make a nice breakfast for her. And then normally we will go for a walk. We will talk, and we will watch the soap opera, and we will enjoy our day. We will have to take care of the house or the plant. And we had sometimes vacations, we would travel. And now that I'm on my own, when I get up, I don't have nothing to do. I cannot think of anything else but how I miss her and how I don't want to spend time with anybody else but her.
Well, it might be helpful to get some social support. Now, is there any opportunity to get to know more people, interact, and maybe get on a more personal level? Were there any activities that you and your wife have done in the past that included some friends or some family?
We used to go to the church together, and I met some other seniors there. And there are some ladies that are also uh, widows, and there are some other people like me. Maybe I could talk to them.
Okay. And now tell me about the immediate people that you do have in your life. And is there things that you like about them, that maybe would draw you to want to spend more time with them?
My children, I have two daughters and one son. They all have children. But children are so different and so noisy. But I used to have a good relationship with my children. when they were little. And I know they care about me. And maybe I can try to call them more often. I never call them. I only get in touch with them when they call.
Well, it sounds as though there may be a couple opportunities for support and interaction with other adults, especially you spoke about your children as they're going through the loss, a loss of their mom, and that maybe talking to them, you can find some support and increase some interaction with your family. I think it's a great start for developing some new support networks, and it can help you through some stages of this mourning process that you're going through. Now, I do want to talk about some of the fears you mentioned earlier related to your physical health, and you had remarked about a friend going into a nursing home. And I just want to touch upon a couple things that we can discuss and some referrals I can make for you in the future. One, most importantly, is some of the fall risks that you had mentioned, that possibly I could make a physical therapy referral to increase some of your strength and some endurance, and give you some recommendations inside your home. Also, having your provider take a look at your medications. You have a couple medications that could be altering your blood pressure. And some of these things, knowing some of these things can decrease some of those fears and increase your independence at home. So would you like me to put in a referral for a physical therapist?
Yeah, that might help.
Okay. Some other things is just getting up slowly, and like I said, going back to your prescriber and looking at your medication profile. Lastly, I just want to teach you some techniques that I think that will be helpful for you. I'm going to give you a handout. It's called the 5 senses, and you mentioned how you were having some difficulty sleeping at night and increasing that alcohol intake. And I think maybe practicing some of these techniques may help. You can use them any time of the day, and you can use them at night before bed, or anytime you just feel like you want to relax and kind of change when some of those unhealthier thoughts come in, like you mentioned, of not really having any desire to live, or any of those intrusive thoughts that come in. The first thing is what you can do. Here's your handout, and you can look at that while we talk. And if you have any questions, let me know. You can bring your attention around 5 things that normally you don't notice. That could be maybe a picture, or just maybe even a crack in the wall. Maybe looking at your refrigerator, could be anything. And then you can notice 4 things that you can feel. Maybe it's the texture on your pants. Maybe it's the feeling of your couch, your skin, how smooth the table might be. And then I want you to notice 3 things that you can hear. And when you're doing that, it might be background noise. It could be noise of an air conditioner. It could be a bird outside. And then notice 2 things you can smell. Maybe it's just the natural smell of your home, or maybe opening a window and smelling the outside. And lastly, 1 thing that you can taste. You can take a sip of coffee or whatever drink you have. You can eat something and just notice what that taste is in your mouth. And this can bring you to the current moment and help with some of those just in distracting some of those thoughts that you're having. And the more you practice, the more easier this will be. And we'll talk about how this technique and intervention worked for you at our next session.
I will try.
Great. I'll
Mhm.
talk to you soon.
Okay, thank you.
Have a good day.
You too. Bye bye.